Hey guys, my name's Sam with Prep Medic. Today I've got Jared here. Jared's one of my coworkers at the hospital. He is also an Army National Guard combat medic. So today he's going to be running through his aid bag and kind of showing you all the contents.
Alright, so what we got here is, this is my personal TSSI M9 bag. So this is what I use with the Army National Guard. Some of these other bags we'll kind of go through here in a little bit. So what I have here is a drop-down bag that goes on your leg. This is something we usually put either on our IBA, our body armor, or we'll put that either on a flick, something like that. Also have a pelvic splint. This is SAM junctional pelvic splint. We can kind of go over that here after a little bit. So this is kind of the main bag here. So it's got two different ways of accessing the inside here. You have your main zipper here, and you have your lower portion zipper here. Of course, I have my PT belt on there for safety, so that way I'm visible at all times. So kind of open this guy up. So we have a few Molle straps here that you can put some of the stuff if you want to put your SAM junctional splint up there, some of those other things. So I try to keep mine visibly labeled, so that way anybody who opens up this bag can kind of take a look to see where things are at. That way if I'm asking for certain items or equipment, I can basically direct them verbally rather than have to go in the bag myself to get items or equipment. We try to keep it in similar to the MARCH format, or HABC, which is talking about your hemorrhage. Typically next would be your airway or breathing, followed by bleeding, then circulation. Have a lot of other kind of loose miscellaneous things that I prefer to keep up here, keep it organized, so that way it's not getting stuck or lost in some of these other pouches. So it's very modular in the way that this is accessible. So we have up here, I have our first, which is our hemorrhage kind of container, which has a lot of our CAT tourniquets. Also, medic's favorite thing, tape. So every intervention that we do, anything that we basically put on a patient, we tend to try to secure furthermore with tape. So especially CAT tourniquets, which we have a mixture in here of the Gen 7s along with the older generations here. Always try to have these loaded, ready to go out of the packaging, so that way if there was a worst case scenario in which I need to utilize one of these, I'm not fumbling through that. I do fold mine in a particular manner, kind of just fit best what's for you. If it needs to go in a pocket or something like that, that might not work. So after that, got my bleeding here, which typically we will have our ETBs along with compressed gauze or combat gauze. As of right now, since we're usually using this stuff for training purposes, we usually don't issue out combat gauze, mostly because it expires. So typically, combat gauze is a lot more expensive than something like compressed gauze. And it's actually been shown that compressed gauze on a few different studies is just as efficient or works just as well as combat gauze, even though that the combat gauze has some of the clotting factors impregnated into it. So ETBs, usually use North American Rescue. Usually have a abdominal one, which I have in one of my drop bags over there, along with your normal 6-inch ones. Next one, we have ACE straps along with Kerlix. So it's other means of just kind of stopping bleeding. ACE straps, of course, we'll use it for other things too. We'll use it for splinting, or if someone sprains an ankle, something like that. But it's usually a big one we use for bleeding when it comes to improvising pressure bandages, especially when you run out of these guys. Or it's also very important for junctional wounds, or any kind of wound where you cannot apply a tourniquet. So we also have our Kerlix or cling, whatever you want to call it, that we typically use for burn or for kind of minor scrapes, bruises, lacerations that don't tend to be hemorrhaging. They're just kind of maybe oozing blood, things like that. So coming down here, we have circulation, which this one usually gets pretty full. So we typically have our IV kits, IV tubing, which I know this looks pretty gnarly with the discoloration, but I promise you it's not expired yet, along with IV fluids. And since we're mostly in a training environment, most of our fluids are going to be NS fluids. Typically, we can get them to another level of care in a pretty quick, timely manner. So no Hexton or other fluids that more advanced things, nothing like plasma or anything like that. We also have Coband, which another one of the medic's favorite tools. Use that for foot issues along with stopping bleeds after IV administration, things like that. NPAs, OPAs are just kind of non-invasive airways that we can utilize here. So I also have my Fox shields up there. So eye Fox shields you can use to cover the eye if there's an injured eye due to burn, blast, anything like that. Typically not used if there's any penetrating trauma with something still sticking out of it. That's not going to work. So there we have our OPAs, NPAs. I don't have any surgical lube in there. Of course, everybody says if you don't have lube, you can always use their saliva, your saliva, or blood. After that, up top here, we have, not only do we have our sharp shuttles, our NCDs, or what do they call it? RSI needles? ARS needles. For some reason, NCDs is what I've always referred to them as, and North American Rescue kind of has their own terminology for that. So ARS needles, NCD needles. Also have down here our occlusive dressings. These are just hyphens. So just have a 10 ml syringe. Typically have that for supraglottic. So I don't currently have in this bag, but we usually have quick access to some of our other breathing airway down here. I do have suction. I do have our BVM as well. Typically there'll also be a Crike kit in here, which mine expired, so I had it removed, along with, we usually have a King in there as well. Most of my population would be men and women from ages 18 to like 35, somewhere in there. So most of our Kings are gonna be either a 5, or sometimes we'll have a little bit larger one too. Kind of up here, I just have miscellaneous stuff. I got some Band-Aids, I got some alcohol preps, Ziplocs, 2x2s, just things to kind of help clean up any minor scrapes or boo-boos, essentially. So down here is where you would access more of my airway kit kind of stuff, along with I have, this is just a visible kind of signal pad that we can use for our landing zone. So it's supposed to be able to be detected thermally with night vision, along with it's reflected as well. So also a bulb suction, which luckily I have not had to use in the field yet. I have never heard of anybody having to use that in the field, and nor do I know of its effectiveness. And then here I just have a blood pressure cuff, stethoscope, and pulse oximeter. I tucked in there. So that's kind of the meat and potatoes of the M9 bag. So another nice thing about it is all modular. A lot of these compartments can come out, so it's all Velcro. So if you really wanted to, you could rip that out, put a bigger pouch on. You could do smaller ones, you could do less. If you wanted to put more fluids in here, you could totally just take one of these out and just stack. So you can kind of base it upon your desires, your SOP or operating procedure, whatever you want to do. So it's very flexible, and that's one of the biggest things that I know a lot of our medics like about it. Another thing is it's very compact for a bag. I know that there's a few other options out there. There's like a Black Hawk, which is a much larger bag. You can fit a lot more gear in it, but unfortunately it's not as modular. Along with, I think, Chinook and Voodoo also have some other pretty good options out there too. So these are the other components that we typically issue out with the M9. So we have our drop leg here. We have a attachment that typically goes on your flick or your IOTV or your body armor. Then we also have a SAM junctional splint. So go through the drop leg here first. So this is a North American Rescue drop leg, and it's one of my favorite pieces of equipment that we have when it comes to our medical devices or securement devices. So with this drop leg here, One of the few perks that I like about it is not only does it secure to your belt with the attachment up here, along with going around the thigh, making sure it's really secure, it stays out of the way of your rigging. So anything that you have, if you have your body armor on or your flick, or if you have just even a large coat or anything like that, this is still very easily accessible. It kind of rests mid-thigh, and then another nice thing is it opens up all the way. So it has a lot of the similar components of a IFAK or your individual first aid kit with a few extras in there. And since it opens up all the way rather than the IFAK, which you have to pull out, you can still leave this on your leg or you can remove it, but it just makes everything very accessible. You can see what's inside. So there's just a few items in here that are different than your typical. I do tend to keep some means of a light source in here, some kind of torch. If it's not my headlamp, it's typically one of these guys. Light's always nice to have, especially when you don't have it. So, kind of going through here, do have a ETB, do have some more cat tourniquets along with trauma shears. Do have a Benchmade, which is just extrication device you can use for basically cutting boots or seat belts, anything like that. MPA ARS needle, along with chest seal here. And then inside here I have just a few other things. I have TC3 cards, which are used for documentation. Fortunately, we're starting to get laminated ones, which make things a lot better. More better, as I like to say. Also have in here some compressed gauze. Never have too much of that. And an A-strap. So again, like when it comes to junctional wounds, you can use these kind of in partnership. You can pack your wound, followed by using something like your A-strap to help secure that in place. Now on the outside here, typically I keep some gloves, and then 3-inch tape is usually tucked all the way down in there. Next thing I'll go through here is this is just kind of a Molle attachment that can go on your flick, body armor, wherever you want to put it. Inside here is usually just going to be extra items that you'd like to have on hand. I do keep my med case in here. I like to have it kind of on hand or nearby. This can be secured in our M9 bag, but just for room, I tend to keep it in here and just accessibility. So just a little Pelican case. Especially in a training environment, we don't carry much for medications. Most of it's going to be things like, well, Tylenol, acetaminophen, bismuth, things like that. We do carry epinephrine, diphenhydramine, things like that for allergic reactions. But for little aches and boo-boos, typically you don't get much of the good stuff. So some more compressed gauze, A-strap, tape, tourniquet, and some chest seals there. So just kind of, this is what we call either a grab bag or whatever you want to put in there, miscellaneous. We let our soldiers kind of essentially design or kind of stock this the way that they feel best suits them. So our last thing I got here is our pelvic sling or junctional tourniquet. This is typically going to be used in the junctional areas or inguinal wounds near the pelvis. So anything that's going to be in and around that area that kind of attaches to the trunk. So this is mostly used for leg wounds, essentially. I've been told that it can be used in some other areas with some kind of other rigging and whatnot. I still prefer, as of right now, for axillary wounds and things like that, to use my A-strap, combat gauze, do it that way. But this has been shown to be very effective with one of the most tricky areas to try to pack or kind of stop the bleed, which is that junctional or inguinal wound down the thigh area or pelvic area. So have not had a chance to really use this other than just an application of just kind of on fellow soldiers. So far, its effectiveness seems good as long as it's applied correctly, which can be kind of tricky. So it takes a lot of muscle memory to get to the point where you're quick and effective with this kind of thing rather than just using compressed gauze and pressure. But this can help alleviate needing somebody to be on a wound for extended periods of time. So other than that, that is the majority of equipment that we're issued or utilized mostly through the Army Iowa National Guard. When it comes to our medical issued equipment.
Thanks for watching, guys. If you have any questions on anything Jared went over today, leave them in the comments down below. I have a bunch of videos coming up, so stay tuned for those, and I will see you next week.